On the matter of schools, yes, we have been informed that in Kakamega, I believe in Kakamega, where we have had that there's a child who has lost his life. We are not sure, sorry? Kakamega, yes, Mumias. And we don't have full information right now to know whether the child got infected in school or got infected at home. But as we have alluded in the past, working with the Ministry of Education, we have said we will take serious surgical measures so that if there are infections in any school, we will close that institution. And on schools that don't have any infections, then we do not have to close those institutions. And as for opening in January, as we have said often, that's an aim. That's something we hope we can be able to do. But of course, you know, there is no hard and fast rule that says if the infections have gone above control or we are being overwhelmed, then we have to live up to that particular statement. We will be free to make statements like those ones when we know that our children are safe.
All right, that's the Cabinet Secretary Mutahi Kagwe. Of course, they are giving details of what is suspected to be a COVID-19 case at, is it Lureko, St. Elizabeth Lureko Secondary School in Mumias. But Dr. Njoki Fernandez, of course, you hear the Cabinet Secretary saying that they will not hesitate to take drastic measures when that need arises. But you also hear Principal Kahi saying that the learners have to be sensitized way before they come back to school, that they have to put on these masks. And when you look around in this country, there's that, should I call it a tragedy, that people are not really adhering to this. If you are to step out of Nairobi, you'll see that majority of the adults are not putting on these masks. What do we do to sensitize these learners, including very young children at the age of 4 or 5, getting back to school or going to school, yet they're supposed to keep themselves safe? How do we do that between now and January 4th?
Okay, so I have many issues I need to address. I don't know whether I'll start with Mr. Indimuli Kahi's sentiments, and then they'll touch on what you're talking about. I mentioned behavior change, and the mask is part of behavior change. And the mask is not easy. For we doctors who wear masks all the time in theater, it's an easy thing, because we walk in, we know the first thing you do, you wear the mask, and you will wear it for as long as you need it. So we're used to it. But for people who have not done it, it's a challenge, and more so for children, because you need that personal self-discipline. So I agree with Mr. Indimuli that we need to have children when they're at home. Whenever they're going leave the house, they must wear a mask correctly and consistently. And it means that we as parents have to be example. We cannot be the ones not wearing the mask and expecting that our children are going to do it. It's a difficult thing. We all have to learn how to do it. The other thing of hand washing and social distancing, we're a very social country. We like close to each other. We like to touch each other and shaking. We're a very society. And something that we have to learn how to keep ourselves separate from managing this pandemic. There's something that is very important that we have to think about now, so that we're prepared for January. He's talked about the interface between the medical fraternity and the education fraternity, and I have to agree with you. In the school policy of 2018, they talk very clearly about health facilities in schools. And I have looked around, I have very many education institutions in this country, and I have seen that there has been some attempt to having sanatoriums or some form of health facilities. Remember, these facilities are being managed by schools, so they're probably not ideal. Now that we're in a pandemic situation, I know for sure they are not ideal. And he's also mentioned the issue of resources. Yeah, so the whole thing that we need to approach stakeholders, and we need to approach parents, feed them, PTA. Let's come up with a budget and see how we can raise money, because otherwise we're going to have a crisis come January. I agree with him totally. Medical problems should be dealt with by medical professionals. The teachers, you've just been projecting their timetable for next year. It is such an ambitious program to teach and to cover and do exams. They cannot be then the ones looking after the health needs of the people. It's not even fair.
Right.
They don't know what to do, and they're afraid as well. So this is an important conversation, and I'm happy Mr. Indimuli has raised it. So I want to throw the challenge back to him. Please mobilize your schools. Please mobilize your BOMs and your PTAs to find a way of resourcing themselves, whether it is through the parents like you have done in your school, through the CDF like His Excellency the President said the other day, by whatever means. Let us find a way of taking this issue into our own hands.
Right.
Some schools have been very dynamic, and I'm very impressed with some of the activities in some schools, but I've realized it's an initiative that is parents, teachers, BOMs, they're very dynamic. Others are still waiting, and I'm urging them, we have time. We have a month or so.
Right.
Let us see what we can do, because let me tell you something, Sammy. We are going home for the holidays. The chances that our children will be infected now are very high. Why? Because we're going into Christmas, and now we're going to socialize more than ever. We shouldn't, but I know we are going to. So the chances that our children are going to come to school in January with COVID infection is high. And we don't have the capacity like Europe to test all of them before they come. So what do? We anticipate and prepare what is going to happen. Yeah. And so that like the schools that have had COVID in their schools, they're still operating, but you're able to quarantine, you're able to isolate. There needs to be some planning and some forethought around this, and we have time. So please let us do it properly. Let us involve all the stakeholders.
Okay.
Let us involve the medical practitioners, and we are very ready to help. We're very ready to support where it is required. Yeah, thank you.
Okay, and Dr. Pamela Odhiambo, you hear Principal Kahi and Dr. Fernandez talking about resources, and this goes back to the ministry as well as Parliament, because you sit in the Education Committee and you're seeing all these concerns. There's a clamor for more resources at every other sector. Is it a possibility that more money can be allocated, or whatever has been promised by the government can be availed as soon as possible to be in a position to take care of these very urgent needs?
Are genuine and valid, and I remember even having talked about them before. And so one thing that I would like to appeal to all Kenyans in all sectors is also, there is this phrase that I've really heard several times from people, especially in the education department, that this problem is a health problem, is not an education problem. I would wish to dissuade people from using this statement, because according to me, I think this problem is a humanity problem, and it is affecting all of us in whatever sectors where we are. So the issue of resources, if we look at this thing from a multifaceted perspective and give it a multifaceted approach, I believe we can actually get around this whole issue. For example, what I mean here is when Teacher Indimuli is talking correctly around the issue of running water in schools, then the question comes, how do we get running water in schools? Where are the resources? All of us need to remember that water issues actually is a devolved function. So the governors of every county should actually ensure that there is a budget for supplying water not only in homes but also in institutions. The MPs have CDF, and to the best of my knowledge, most of this money is only supposed to be used to handle security issues, for example, building some offices for police or chiefs or something like that, and then facilitating our schools to get either some infrastructure like classrooms or water and electricity. And apart from that, there is also the Ministry of Water, Irrigation, and something like that. This is also a ministry which is having a budget to ensure that our country is watered with clean running water. So in the schools, through the Ministry of Education, I know recently what I heard from PS Belio Kipsang in one of the meetings where we called them, is that they had released something that what was called, we had given them some stimulus budget, and on top of that, they have always had what is called improvement funds. which is supposed to improve on the infrastructure of the schools. I want to believe that if all these Kenyans who are handling these resources were genuine enough to make sure that these resources reach, including our schools, we should be having running water, for example, in our schools. And I also remember at the onset of this pandemic, considering the scenario at Migori County, my heart went out, especially for the issue of water personally. And I remember mobilizing the resources that I have, the little in the name of GAF. And I went on a spree of buying big tanks to give, especially to our primary schools and secondary schools, so that these little children can at least have some little water stored in the school for them either to drink or to wash their hands per se. I'm still doing it, and I want to call upon all the other leaders and stakeholders of education to look to the direction of our schools and make sure that we give the support that is required. Having said that, the component of health, yes, it is true that when it comes to disease, even handling a toothache or malaria, surely the teacher is not well equipped to do it.
Right.
Long time ago, as teacher had said, I also remember in the school where I learned, the Dede Girls where I went in Awendo constituency, there was some nurse and there was some facility, some room where whoever was sick reported, and there they were given some, at least some first aid help. And if their condition was not manageable by this nurse, we would be referred to some health facility outside the school. And I think, I really don't know, it's not clear to me this morning what made this thing die. And the other day when we were discussing this again here, I remember the ministry saying that as they were going around checking the schools, they had ensured that most of the schools there was some health facility nearby, which is true. For example, if you talk of, say, like Alliance Girls, yes, they have some sanatorium in the school, but then there is also Kikuyu Hospital or next there on the standby. And these are the issues that we need to really look at. As we send these children back to school, the Ministry of Health down to the county, can they help us ensure that there is enough facilities in these schools so that, I mean, in these health centers next to the school so that our children could get help?
Right.
And having said that, Sam, the behavior change that my colleague, Dr. Njoki, has just mentioned, it is really proving an uphill task. But I think here again, we need to confront each other as Kenya. This is not a problem of the Ministry of Education, nor is it the problem of health sector. It is the problem of the people now.
Okay.
Why are we resisting this? I am really pleading with the entire Kenya. This cannot be done through parliament, because I've even seen the security reinforcing organs trying to arrest people and even throw them in cell and charge them, but Kenyans are still adamant. So the question is, let the Kenyans be willing to at least do something that can save them and save others. It is not normal for us to wear masks, yes, but now that this is what is required to stop my saliva or my breath from attacking somebody else, we just have to do it. And there, I think there shouldn't be any compromise on anyone. And to the extent that even relatives, it may call for a drastic measure. I know, like where I come from, this may be looked at as very awkward. But you might even have to stop relatives from coming to your house because what is the need of clumping together, even in funerals, and you are burying one person thereafter, you are burying 20 people. It doesn't make sense.
I hear you, Dr. Pamela Odhiambo, and now Peter is joining us by way of phone. And Peter, if you can hear me, so now we had raised the question, I don't know whether we have Peter, I had raised the question with you about the experience with the private schools, and of course you hear the concerns, behavior change is a challenge, people are not putting on their masks as they should, and this is going to take a long time. How successful have you been in enhancing this? Peter, if you can hear me? Well, again, we don't have Peter, but now let's focus on the reopening of schools, because we had the Cabinet Secretary, George Magoha, giving those new term dates. And when I look at a quick look at the term dates, it shows you that initially, the first term used to be 14 weeks. The second term used to be almost 14 weeks again. And the third term was about 7 or 8 weeks. I'm looking at the calendar of 2019. But Mr. Ndimuli Kahi, when you look at the new term dates that have been given by the Cabinet Secretary, it will show that the second term of the current academic year will have 11 weeks. The third term will have 10 weeks. And in between, there will be a holiday of 7 weeks to allow KCPE and KCSE to be conducted. When you look at the projected term dates, how will you be in a position to recover the time loss, or at the same time achieve as much as you can in coverage of the syllabi in the reduced term dates?
Thank you very much. I want to state that the time given is more or less adequate. Normally, from the Kenya Institute of Curriculum Development, the curriculum can effectively be covered in 30 weeks, but it has been given 39 weeks in the normal calendar to take care of any other programs that come in during the normal school days. That's why we go up to 39 weeks. But effectively, 30 weeks, the curriculum can be covered. That is why you've noticed that there has been a reduced midterm from normal 1 week to 3 days. There will be very short holidays so that we are able to cover the syllabus within the 30 weeks given. If you look at the number of weeks given in term 1, term 2, term 3, they are totaling to 30. Now, the longer period for holiday is to take care of examination management. You remember in 2015, the reforms in examination management were instituted. Therefore, we will not allow the pandemic to make us forget these reforms in managing issues of exam malpractice and the rest. That is why that period has to remain there. And during the examination period, all the students, apart from the candidates, are expected to be at home. Teachers are expected to be at home, apart from the principal and maybe a deputy principal to manage. So that is why those term dates have been done. And because we do not operate alone, we are also in cooperation with the other East African countries, whose academic calendar starts in January. So every effort had to be made to ensure that we harmonize fast enough to be together with the other countries, so that we do not appear to be running our own calendar, yet we have our children that leave Kenya to go and do Uganda and in Tanzania. Delaying further would mean such students would have to wait for a whole year before they go in for A-level. So that is why that crash program had to be put in the way it is.
Right.
I'm saying this because I was a member of the COVID the response committee, and this is what we discussed through and sharing with other stakeholders, and that is why those dates are the way they are. I stand with them.
Oh, okay, all right. And of course, there's the word that should anything change, then they might be altered. I'm just wondering, Principal Kahi, because for the few weeks that you've been having the Form 4 candidates in school, and you've witnessed the challenges, especially with the behavioral change, the observance of social distancing, as well as the hand washing, and the challenges you face with financial, the availability of finances to do what you need to do. How much of a challenge will this extend when you reopen schools? Obviously, you would expect then larger numbers to be had, but how are you planning to ensure that you continue the social distancing, never mind that now you have fewer classes that you can stretch your students into?
The issue of social distancing, is a pipe dream, and I want to mention this. With our population in schools, social distancing at this point in time will be difficult to maintain when all the students come. Most of the schools that we have are already using 50% of their available classes with the candidates alone. So you can imagine when how much is needed. So social distancing as a country is something we can say by January we will not have achieved. And therefore, in no uncertain terms, enforce wearing of masks, and this is compulsory. The children must start wearing from. Then we must emphasize on constant hand. Then, of course, we will need to be doing a lot of sanitization of pillars in the school, staircases, and that's why I was saying we will need more. For example, we will have to understand the funding model of government.
Right.
Because we may be having, within a year, instead of 3 terms, we may appear to be having 4 terms because they are overlapping.
Right.
So there will be need for the funding model to be fully understood by all so that the principals can adjust. And this is where I want to appeal to our Mheshimiwa, who is a member of the education, that they may need, and I want to ask, how come from the time of the pandemic, the Education Committee has not thought of inviting the heads, both in primary school and secondary schools, to come and share with them some of the challenges they are facing? Okay. Because we are the people handling and practicing, and therefore they should have also gotten information from us.
Sure.
And they can also look for extra funds from the way they know as parliamentarians to give the Ministry of Education more, to fund these schools more, to have those containment measures put in place and on time.
Oh, all right. Even though Dr. Pamela Odhiambo says that this is a challenge not just of the parliamentarians, but also everybody in the country, and I don't know that that helps.
That is true. That is true.
Yeah.
Just a minute. It is true what she's saying. I totally agree. But who apportions the funding in this country? Is it not Parliament?
It is Parliament, but the point I'm trying to raise is that there is demand for finances across different sectors, including now that, you know, the doctors, a profession that Dr. Njoki Fernandez comes from, they're already crying foul and saying that they have not been treated as they should in terms of their welfare. But Dr. Njoki Fernandez, the reality in the schools at the moment, already seeing, for instance, at Cabernet Boys, 38 boys contracting COVID-19, and the challenge will be bigger come January 2021. And I know that you spoke about people changing behavior, but what is the reality? Because it will take a miracle to construct the classes that the president was speaking about by January 2021 for the learners to occupy. What are those quick wins that we can fix within the very short time that we have, while also making use of the limited resources that we have to ensure that even as the learners go back to school, they stay safe and protect their folks at home, especially for these scholars?
Thank you, Sami. And this discussion on resources is a never-ending one, because we never have enough and we always have demands. What is true about the medical fraternity is true. They need to be looked after and they need to be protected as a priority, because when we get sick, we expect to go to health facilities, and these are the people we expect to find. So if they're not available because they're unwell or they have passed on, then it becomes a tragedy, and they are offering they cannot work from home. So that one for sure, I feel that is priority funding. The second thing, quick wins. We might not be able to have suggestions that require a lot of resources. And I like what you're saying. What can we do at institution level, school by school, to make sure that we as a school are ready for our students? I think it has to be broken down to that level. Because otherwise, if we keep looking at it globally, the education sector is so big, we will never have that kind of resourcing in 1.5 months, because schools need to open in January. So again, I throw the challenge back to Mr. Indimuli. For your institutions and for the primary school, are we able to empower your BOMs and your PTAs to mobilize resources at a school level? Let each of the schools come up with their budget for hand washing, because water is a cost, soap is a cost, whatever social distancing they can do. The masks you're talking about is a cost. How can we meet that cost as a school? I hope I'm not saying anything controversial here, but it's the only way to go if we take up this responsibility school by school. And then I also want to appeal to the private sector, corporates. I know we don't have too much, it's been a difficult year, but I think corporates can identify schools that they can work with. If a school has a budget of 2 million shillings per term or whatever, pocket can come to help. Rest alumni of these schools that we have been to, can we also chip and help? Let us all be proactive in this discussion. Let's not sit back and say we're waiting for government to provide the resources. It will not happen. So it's a high time. These are our children. Let us mobilize all the resources we can. Let us help them. There's something that Madam Pamela said, and I wanted to weigh in on that.
Go ahead.
She talked about a school that has got a health facility next to the school. But I want to remind her that that health facility is not only serving that school. It is serving probably the 30 schools that are in that area and also the general population. So you're going to have a situation where that one facility will be overwhelmed if we do not find a way of decongesting, so that the children who are taken to the health facility are the ones who are very sick. Not common things, cough, cold, eye infection, a bit of sneezing, a bit of, because then the children will all go and conglomerate in the school, in the institution, and that is now exposing the children and the members of staff to including COVID. So we have to try and limit the movement of our children when we go back to school as much as possible, and it needs to be intentional. So what I'm thinking is, if as an institution you sit down, the principal, your PTA, your BOM, and come up with a plan for your school, look at the budget, see how much is it going to cost me to sustain this for the next 1 year. Then you start resource mobilizing your CDF, your parents, your alumni, the church community, whatever you need to do. Let's not always push it to government, because it's not going to work. I mean, honestly, we'll have this challenge even until January, because the government has many things to think about.
All right. Of course, every person feels that there's something else, something extra that the other person can do. I just hope that we can bring all this together. But Dr. Pamela Odhiambo, I know you are an educationist. I'm looking at your CV and seeing that you have a PhD in educational research. And let's first listen to the Cabinet Secretary for Education, Professor Magoha, as he spoke about the school resumption yesterday. Then I can raise the question with you.
All schools will reopen fully on the 4th of January 2021 and end on the 19th of March 2021, together with grade 4 candidates. All 4-year-olds will join PP1 in July 2020. I wish to assure the country that the government is determined to ensure a safe reopening and learning of our schools. In doing so, we are drawing important lessons from the partial reopening that has taken place since October. We are confident that we will remain on the right trajectory to finding the winning formula.
Right. There was another clip of the Cabinet Secretary talking about the safety of learners while at other institutions. Let's listen. Okay, all right. And Dr. Pamela Odhiambo, so you hear the Cabinet Secretary speaking about the school. I mean, I want to now focus on the psychosocial health or the mental health of learners while in school. I mean, the last time they were in school was 9 months ago. A lot has happened over time. They have been hearing these reports of the coronavirus. They even have a nickname for Cabinet Secretary Mutahi Kagwe, Mtu wa Corona. And now they are told that they have now to go back to school, get exposed. They are reading these stories of learners who have contracted the virus. Unfortunately, a student is suspected to have died of the virus. How do you take care of them? Well, you have to take them through a marathon program within 10 or so weeks of coverage, yet expect them to have the best outcomes when it comes to education and getting an education at their age.
Thank you very much, Sam. First, allow me to correct something. You said you are looking at my CV and you see that I have a PhD in educational research. My PhD is in strategic management.
Okay.
And I think that is how it should be. Having said that, I acknowledge the fears and worries of my headmaster there in Ndimuli about the issue of Parliament apportioning resources. But as Dr. Njoki acknowledges, all the other sectors, remember, their operations are still in full. And then this resource allocation, it is a cycle. The government is supposed to be raising some revenue through taxation, and then maybe any other sources like debts, which I don't like talking about very much, because sometimes I think we really don't have to borrow so that we live luxuriously. We would rather suffer with the little that we have to be able to grow and move from there. That's my perspective, but that's a discussion for another day. So now, when we are talking about of this resource allocation, that's what I was explaining earlier, the kind of resources that I think Parliament has apportioned to various sectors of this economy, which should be channeled to what we are talking about. And so I was telling the teachers that when we talk about water, then this is not a Ministry of Education affair. It is the Ministry of Water affair. When we are talking about devolved funding, this water is allegedly further devolved to the county. And therefore, what we are saying here, let Kenyans understand properly the system that the government is using to allocate resources to mitigate against various needs in the society. If we just demand for water now from the Ministry of Education, Mr. Indimuli being a principal, I think he understands the roles of the Ministry of Education. And that's why we are saying in the Ministry of Education, in the last budget, we gave them something that was called the stimulus response to COVID-19, and then improvement of allocation, which is always there. Now, these two funds is what we were hoping as parliamentarians, and I think I have heard P.S. Belio talk about it, that the principals were allowed to use this to make sure that the issue of water and sanitation is taken care of as a priority in this time. And some of us parliamentarians have also gone ahead, like I said earlier, to assist to make sure that there is water in school. The other day, the president was actually calling upon specifically the MPs with their CDF to make sure that the schools are ready. As I talk here, I am aware that the ministry had actually released to a number of schools the infrastructure fund. There is a long list. I may not have it here to share with you, but there is a long list that recently monies were released to schools in the tune of 1.5 million, 2 million, 2.5, like that, 5 million for infrastructure. And I believe if these ed teachers and the PTAs and the BOG just try to construct a simple classroom, I believe in a month, this month that is remaining, these guys can actually at least raise 1 or 2 more classrooms than what we have had.
Maybe we can get a confirmation. Dr. Pamela, maybe we can get a confirmation. We can get a confirmation from Principal Kahi. Have you received that money that Dr. Pamela Odhiambo is talking about?
That is what he may need to tell us.
Principal Kahi?
From the Ministry of Education,
yes.
showing schools.
Principal Kahi, go ahead.
I have no objection on what Mheshimiwa is saying. Mheshimiwa is saying the right thing. There has been money that was allocated to some schools for infrastructure development. That one is there, some schools have received. I'm not objecting to that. And I'm not blind to the fact that how government is funding. What I'm simply saying is, yes, there are other players who must come. What efforts have we put in place to make these other players come in? For example, the county governments. You know, many times they would say that education is not devolved. You know, so those are some of the things I'm saying that we did.
All right, that's okay, Principal Kahi. Just a moment. When all of us speak, we cannot hear each other. So let's just speak one person at a time. Principal Kahi, you have responded to the question that some schools have received their infrastructure money. Dr. Pamela Odhiambo, please continue with your point as you respond to the question of the psychosocial support for learners.
To emphasize that the principal should take this home kindly. Education is not devolved, but water is devolved. And therefore, when we are talking about this, I am confident that the county governments plus the Ministry of Water should actually be the forerunners. That's why I started by saying, let us not look at this thing to take opportunity just to blame one particular sector of the economy or the government, the Ministry of Education. There are those things that the Ministry of Education can do. But the things that we need from another ministry, let's also follow them and let them be there in our schools. Having said that, I was saying that the stress that our children have just the same way that they are stressed at home when they hear these reports, from a teacher's perspective, what I would request my teachers to do, and all the other people, pastors, parents, and everybody else, let us speak encouragement and discipline in the ears of our children. For example, myself, my grade 4 child is actually been in school. And if I may speak on behalf of Peter, she is in a private school and she's a day scholar. Thank God, so far, since they started going to school, we've not had any cases in this private school of any reports of attack. Now, what we have always done is this constant encouragement and counseling. Much as they go to school, I encourage my daughter, make sure you are masked, make sure you wash your hand, don't touch anybody's thing which is not yours, and just keep to your desk. I think the psychosocial setup of our children, again, it is a role that I would request that the teachers, as they welcome the children back to school, let them take the first few minutes to counsel the children and encourage them and make them know that they are there to take care of them and they will do the best they can together with them to make sure that they are safe. At home, let the parents speak the same thing and do the right thing with the children. In church, let the pastors also speak. If the entire society takes it a responsibility to reassure our young people and encourage them to do the right thing, I definitely believe we will fight together. Because the reality of the matter, Sam, if you may remember, even those early days when I still used to come to the studio, I was crying that even in the villages where the children are, even the ones that are not going to school now, they are not quarantined. They are not single in their rooms. They are all over the place, just mingling in the society. I remember around the month of May and July, I was in the villages looking for my girls to at least give them some sanitary towels and advise them to continue reading, because the issue of social interaction sexually was getting too high and they were getting pregnant and some were getting married off. So I think what I'm saying is, let us all, as adults and grown-ups, the media and everybody else, let us preach encouragement to the children. And as we were saying, we emphasize the behavior change. Let us tell our children the right behavior that they may need to keep healthy. In the unfortunate event that any of them gets infected, let them not keep quiet, let them not shy off, let them report it immediately and let them be helped to the nearest health facility.
Okay.
As for the issue of health facility in schools, I think my position together with Dr. Njoki is there should be a health facility in its simplest form in school, and a medical person. That's why I said when I was a young girl in school, there was some nurse who was employed in our school to take care of us. And even today, I don't think we are in short of staff. I am aware there is a new graduate of medical staff that have just graduated. Some of them have just finished their internship. Some of them are actually joining their internship. This whole caliber can be trained very quickly, and they can be even posted to schools to assist in just being there to test the children, as our colleagues have said. I think that is a right move. And I think what we can do is to encourage the Ministry of Health to see how fast they can do that, because, again, the Ministry of Education cannot post health personnel to any institution in Kenya.
All right, and what appears, what is up? Just a minute, Dr. Njoki. What is apparent is that it's pretty expensive to really manage this pandemic. Whether you have contracted the virus or you're protecting yourself, is pretty expensive, and that's what we'll be talking about. Even after the Teacher Service Commission has now promised the teachers that they have negotiated with their medical cover providers to ensure that they are covered while in school of COVID-19 complications. We'll also be looking at what parents, teachers, and other stakeholders can do during that season should one of theirs contract the virus after the break.